So we've talked about how to control, or we've talked about how microbes grow in chapter 4. And then we talked about microbial metabolism in chapter 6. So now they're growing and how do they metabolize? How do they produce their own food? If they do, how do they make energy so that they can build up or break down different things? In chapter 5, we're going to talk about the control of microbial growth. And so, as a reminder, prior to Joseph Lister's work in the 1800s, we didn't have and so I will say, the knowledge wasn't out there that microbes were causing disease. And Joseph Lister is one of the individuals that helped in proving that microbes, which do exist, cause disease. And one of the things he did was he improved the surgical procedures. So what I put up here, this is all of these figures, well, these 3 figures came from Google Images. This came from your textbook. What this is showing is a barber who is shaving the face of a person. Here's another person that was just shaved using the same knife. And over here you have 2 people operating on this patient. They're not wearing gloves, they're not wearing masks, there's no protective mechanisms. That's what it was like in the 1800s, in the 1700s, in the 1600s, in the 1500s. Since people didn't realize that microbes were causing diseases, they didn't protect themselves and protect their patients. And so a lot of people died. I mean, a lot of people died. Joseph Lister's carbolic acid machine saved countless lives, because not only did he spray the wound area, the tissue, but he also started sterilizing the materials used in the operating room. And so this is what we have today. If you're going to be operated on, you're going to have gloves, gowns, face masks. You're going to be completely protected in a sterile environment. And this all started with Joseph Lister and Semmelweis. So chapter 5 is all about the control of microbial growth. So I'm going to remind you that not all microbes are bad. I thought that was a cute little figure of a microbe. He looks kind of creepy, but he also looks sad and maybe adorable a little bit. There are a lot of approaches to controlling microbial growth. Sterilization versus disinfection, versus pasteurization. These are all different mechanisms. There's actually another page of definitions. So these are just definitions that you do want to know, that all help in controlling microbial growth and are all going to be used in different situations. When we're dealing with tissue, so host tissue, we can use chemicals to either kill or inhibit growth of microbes. Depending on what we're doing, then the host immune system has to take over. So if the chemical is considered a cytal agent, then it will kill the microbes straight out, and the immune system has nothing to do. But if the chemical is a static agent, then it just inhibits the growth. So on this side, you can see some bacteriostatic agents. These guys won't be able to grow, and so your immune system is going to have to take over. Whereas over here we have cytal agents. Cytal agents are going to be killing the microbes straight out. Your immune system doesn't have to do any work. So what are some of the situations? You want to look at where you're going to be controlling microbial growth, what the type of microbes that you're going to be using are. So in a kitchen, we're going to use different standards of controlling microbes than we will in an actual food processing plant or food preparation plant, I guess that would be. If we're controlling microbes in a water treatment plant versus a hospital or a laboratory. Each of these is going to have their own types of microbes that we're dealing with, and we're going to want to control them in different ways. You would never use the same mechanisms in a sewage treatment as you would in a kitchen. Here you would use a rather concentrated form of chlorine, whereas over here you might use a very, very dilute bleach solution to clean your counter after cooking. In daily life, the most important mechanism we have for controlling microbial growth is mechanical removing through washing. So scrubbing your hands after going to the bathroom, washing your hands before eating, washing your hands after playing with animals. That's going to keep the potential infectious agents down while not messing with your normal microbes, because the normal microbiota, your critters, are going to be found living deep in your skin, and they're going to be protected from washing, and there's so many of them that those that do come off will be replaced rather quickly. In hospitals, the hospital staff are always concerned about the acquired infections, which so HAIs and nosocomial infections are the same thing. They're acquired infections from the hospital. A lot of times, patients that are in a hospital, no, not a lot of times, are typically going to be more prone to infection because they are already ill or immunocompromised in some fashion. And now you're dealing with an environment that is teeming with pathogens because that's where people go to when they are ill. And so in hospitals, the staff are constantly using mechanical mechanisms to control microbial growth. They're gowning up, they're wearing gloves, they're protecting each other as well as their patients. In surgery or in other, I say surgery, but any type of test, laboratory test, or hospital test that you're going to have, they're going to use sterile equipment on the patient to keep the patient from getting ill and to keep the patient from having any microbes be transferred. In a laboratory, specifically in microbiology laboratories, we are using a lot of different control mechanisms, including mechanical removing by wiping things down, washing hands, as well as using aseptic technique to keep everything from getting contaminated. We're using special mechanisms to control microbial growth on foods. If you've ever went to a farmer's market, which most people have at some point in their life, Farmers markets sell very delicious foods, but the foods don't last very long. One of the reasons for this is that the foods have not been treated at all. And so when you have these different treatments, when you add the treatments to the food, you're going to allow the food to last for a longer period. Typically, what they're doing when they are treating the foods is they're killing off those spoilage microbes, so food will last a longer time. One of the most effective mechanisms is irradiation. Irradiation treats the food so that the foods can last for a longer period of time. If you look up here, you see strawberries that had no control, had nothing put on them. So these are spoiled completely. These are strawberries that were heated for 10 minutes. So they used heat to control them. These are irradiated strawberries. Irradiated strawberries have radiation, or get radiation, and basically the radiation keeps the food or keeps the microbes from growing, in this case, the fungus from growing. Here we have a little bit stronger irradiation, and from here to here you can see there's less microbial growth. And the best, though, is when you use heating and irradiation together. You have these beautiful strawberries that will last for a longer period. Water treatment, so this you're looking at like sewage plants. You don't want the water that you're going to drink to have any pathogens, and all the water that goes down your drain goes into a water treatment facility and has to be cleaned. And so the most effective mechanism for this would be using chlorine. Chlorine is very effective. It's the most common water treatment, and it kills almost, I won't say all, but almost all microbes. It does produce some byproducts that could be potentially harmful. So there's a lot of things that we're going to look at in Chapter 5 that will determine what type of procedure or chemical we're going to use. Some of the choices are going to depend on what types of organisms we're dealing with, how many organisms, what the environmental conditions are, the risk of infection, and then the composition of the item. So when we kill microbes, they die exponentially, just like they grow. And because of this, we know that well, hold on. Stopping it actually.